There is a new GLP-1 weight loss pill on the market. It is called Orforglipron. You may eventually know it by the brand name Foundayo. In a large clinical trial, it helped some people lose over 10% of their body weight. So the real question is, how does it work? And how does it compare to what we already have? Welcome to Science My Health, your channel for health and research information. What is Orforglipron? Orforglipron belongs to a group of drugs called GLP-1 receptor agonists. These help control appetite and blood sugar by mimicking a hormone your body already makes. A simple way to think about it is that it helps you feel full sooner and helps your body handle energy more efficiently. The key difference is that this GLP-1 drug is a pill rather than an injection. Also, there are no strict timing requirements around meals, so it can be taken with or without food. It is just taken once a day, which could make it much easier for people to start and stick with their treatment. How the study worked. To understand how well it works, researchers ran a large clinical trial with over 3,100 adults with obesity. The study lasted 72 weeks and compared different doses of the drug to a placebo. Everyone also received guidance on diet and physical activity, which is important because it helps researchers see what the medication is doing, in addition to lifestyle changes. How much weight did people lose? Now let's get to the results. After 72 weeks, people taking the medication lost significantly more weight than those on placebo. The lowest dose led to about 7.5% weight loss, the mid dose about 8.4%, and the highest dose about 11.2%. In comparison, the placebo group lost only about 2.1%. Higher doses clearly led to stronger results. More than half of people on the highest dose lost at least 10% of their body weight, and some reached 15 to 20% or more. That 10% mark is important because it is often enough to improve real health outcomes. Health benefits beyond weight. The benefits went beyond the scale. People taking Orforglipron saw improvements across several important health markers. Their waist size decreased, blood pressure improved, cholesterol levels got better, and triglycerides went down. For people with prediabetes, many returned to normal blood sugar levels by the end of the study. This shows the medication is not just helping with weight, but also improving the underlying health risks that come with obesity. What kind of weight was lost? Not all weight loss is the same, so researchers looked closer. In a smaller group, most of the weight loss came from fat, especially visceral fat. This is the type of fat that surrounds your organs and is most strongly linked to disease. A smaller portion came from lean mass, which is expected with most weight loss treatments. Overall, the pattern of weight loss looked clinically meaningful and consistent with effective therapies. Side effects and safety. Like similar medications, the main side effects were related to stomach and intestinal tract. People most commonly experienced nausea, diarrhea, constipation, and vomiting. These were usually mild to moderate and often happened when the dose was being increased. Some people did stop taking the medication because of side effects, but serious events were relatively uncommon and occurred at similar rates compared to placebo. There were a few rare cases of pancreatitis, but no major safety concerns stood out overall. Why this matters. So why is this important? This study shows that effective weight loss might not require injections. A pill like Foundayo could be easier to start, easier to stick with, and easier for more people to take. The weight loss is slightly lower than some injectable options, but convenience can make a difference for many people. So where does this leave us? Weight loss treatment is evolving, and it may be becoming more accessible than ever. Like this video and subscribe to Science My Health for more easy-to-understand health research news.